My name is Gustavo Barros. Today, I'll be talking about calcium for older adults. Calcium is the most abundant mineral in the body, maintaining musculoskeletal health through bone formation and maintenance. Men of 51 years of age to 70 years need 1,000 milligrams of calcium a day to meet their daily allowance, and women, they need 1,200 milligrams a day. Once they get to the age of 70, this increases to 1,200 milligrams a day for both. Some food sources of calcium are cottage cheese, for example, and some fortified plant-based milks. Other dairy and dark green leaves are also some sources of calcium. As we get older, calcium absorption decreases in our bodies. Calcium deficiency could cause osteoporosis, osteopenia, fractures, dental problems, and hypocalcemia, which is a severe deficiency that affects nerves, muscles, and the heart. It is important to be aware because toxicity can happen. Through the ages 51 to 70 years, toxicity can happen from values above 2,000 milligrams a day for both men and women. To prevent toxicity, it is important to stay within the recommended intake. Avoid unnecessary calcium supplements and meet the calcium necessities through food. Take supplements only if recommended by a physician, and also it is recommended to maintain vitamin D levels to support calcium metabolism. It is important to pay attention to the daily value in products. For example, here in the cottage cheese, we have 13% of the daily allowance of calcium, and in the soy milk, 23. Some micronutrients that enhance calcium absorption are magnesium, vitamin D, and vitamin K, but some other foods can inhibit its absorption. For example, beans are rich in phytates, and some leaves that are rich in oxalates, for example, spinach. Excess of caffeine can also increase calcium excretion. Also, sodium increases calcium loss in urine. Large amounts of phosphorus present in processed foods and drinks can also negatively affect calcium balance in the body. Some good combinations and some food ideas to increase the intake of calcium is, for example, having scrambled eggs with some cottage cheese. Both have complementary micronutrients. For example, the eggs have the vitamin D and the cottage cheese has the calcium. Another idea for calcium intake is a kale salad. A cup of raw kale can contain up to 9% of the daily value of calcium, and in pairing foods throughout the day to increase your intake is very valid as well.